Todd Ellerin, Director of Infectious Diseases at South Shore Health, to talk about COVID-19. We always appreciate your time, Doctor. In an internal White House report, Dr. Deborah Birx said, quote, "We're entering the most concerning and the most deadly phase of this pandemic," and also, quote, "We need much more aggressive action." So two questions here. Do you and your colleagues believe that this is the most concerning and deadly phase? And what might that aggressive action be that she says is needed?
Maria, we're definitely entering what looks like the potentially most deadly phase. Let's face it, there are close to 100,000 cases in the United States and around 1,000 deaths per day. Okay, so you can only imagine that when we hit the number 200,000 cases in the United States, there'll be 2,000 deaths per day. That's in 1 month. When you think about that, 60,000 deaths in 1 month. We typically see in a bad flu year 60,000 deaths, and that's over a 5-month period. And that's not all. A woman just left my office 3 hours ago who recovered from COVID 3 months ago, and yet she's lost 60% of her hair. Oh. She can't stand in the shower. She has a career that requires emotional and intellectual stamina, and she's standing in a store that she's been to every week, standing there for 5 minutes trying to figure out where the toothpaste is. So it's not just about life or death. This post-COVID syndrome is also very severe and destabilizing.
Wow, that's a fascinating and troublesome story, Doc. Okay, we were just talking about kids a few minutes ago. The American Academy of Pediatrics says that COVID-19 cases in children are rising quickly. 200,000 new cases in children in October alone. That's almost a quarter of all cases in children since March. Is there any indication how they're being infected? Is it household transmission with adults?
Well, as you know, through the clusters that we just heard about in Massachusetts, a lot of it is through household contacts. But remember, in households, you have people in for extended periods of time together at short distances. But again, remember, also someone had to bring it into the house. Mm-hmm. We don't know where all those places are. But one thing I have to say is schools are doing really well at keeping those case counts down. But whether it's schools, sports, in the community, there's a lot of transmission. We bring it back into the home, and from the home, we go back into the community. So it's a vicious cycle like that.
Let's talk about a vaccine. There were indications just months ago from the White House that there could be a vaccine ready by Election Day, and it's Election Day. There is no vaccine yet. So can you give us an update on some of the trials and what you think a potential timetable could be for the very first vaccine?
So, Maria, we still are waiting effectiveness and safety data that hasn't been released. Until that's released, we can't take the next step. But I will tell you, there are millions and millions of doses of vaccine that are ready to go, but they're waiting on the FDA for an emergency use authorization, which no company has asked for yet because we have to wait for the safety and effectiveness. But I do want to get back to the first question you had, Maria, which is essentially what can we do right now in the United States? Look at what Governor Baker just did. Those are the type of measures we need to do. Control targeted measures, not widespread shutdowns, but the curfews, the fact that certain businesses have to close by 9:30, whether it's entertainment, alcohol, marijuana, that type of stuff. Also, that mandating masks, very important. We need to not only mask outside the home, but we have to mask inside the home, since that's where more transmissions are happening.
Dr. Ellerin, thank you so much for your time. You always bring a lot for us. And for the